Welcome to Tea and Cornbread, a conversation with Sean and Tracy, where warmth, wisdom, and community come together. Just like a good meal shared with loved ones, our podcast brings heartfelt conversations with incredible people who are making a difference.
We spotlight community leaders, change makers, and everyday heroes who uplift, encourage, and support those around them. Grab a cup of tea, pull up a chair, and join us as we share inspiring stories, real talk, and a whole lot of love. Because when we come together, we nourish more than just our bodies, we feed our souls. Hello, everyone. It's Tea and Cornbread with Sean and Tracy. I'm Tracy.
And I'm Sean. And how are you all today?
I am well. How are you?
Good, good. I can't complain. How was your weekend?
My weekend was good.
It was good?
Yeah.
Okay.
Had a lot going on. How about your weekend? What did you do yesterday?
It was good. It was a mental health. We spoke at was one of the honored speakers at a mental health event yesterday. So that was great. Talking about winter blues.
And that was nice. I'm sorry, my sister, I couldn't be there.
That's
I was
right.
also at a health event that went on yesterday in Waterbury. So, but nice.
Yes,
We have
yeah.
a great guest that we're going to be talking to in a few minutes
On that
subject.
yes,
Yes.
on health
On
rather.
health, yes.
On health, specifically men's health.
Definitely.
Yeah,
Definitely
that's
a
what
good
our theme
topic. We're
is,
staying on
right?
topic for November.
Yes, man up for your health.
There you go.
Man up for your health. All right, so we're going to do our breathing, and then we are going to read a devotional real quick, and then we're going to jump right in. All
Okay,
right?
let's do
so
it.
how we do our breathing is we sit straight up, feet flat. We usually have an essential oil. It's in the car.
Okay.
So that's okay.
We forget stuff. I forgot my book.
Right.
Which one? Oregano?
Yeah,
No.
exactly. Actually, I did have oregano in
You
my
had oregano today?
in my
Oh, in your bag.
pocketbook, and it's
Okay.
not there. But yes.
Okay.
So oregano, and we can talk about that too, because he knows about this too. All right, so we're gonna conjure up some energy, and as we conjure up some energy, we're gonna bring ourselves to focus to where we are right now, and our intent for today's conversation, and hopefully we bring value to all of you all that are out there watching, listening.
That's the intention.
Yeah. All right. So we're going to do it 3 times. We're going to deep breathe in our nose, hold it for 4 seconds, and then exhale out of our mouth. And when we deep breathe, we're deep breathing in our intent, and we're exhaling all that doesn't serve us. All right. Let's do it. One more time. All right. Last time. And for us, that brings our nerves down. That brings our nerves down. So I'm gonna it's a scripture, really. It's from Psalms 139, which our group has been studying.
Okay.
Psalms 139. And it says, "Search me, O God, and know my heart. Try me and know my thoughts." All right.
Mm.
Amen. All right. So listen, I'm super excited about this conversation that has been, I mean, how long? We've been waiting for this conversation for a while. I am honored that we have Dr. Sean Fullerton, here from New York and Danbury, by way of Danbury. And I know him through his wife.
Right.
My first time meeting him in person, so this is great. I'm
Pleasure to be here.
so excited
Thank
about
Thank
you
for
being here.
here.
So Dr. Fullerton began his medical journey at City University of New York, obtaining his bachelor's in biology. From there, he attended the State University of New York Health Science Center in Syracuse, earning his medical degree. His residential training included general surgery at Lincoln Hospital and urology at Westchester Medical Center, New York, Medical College. Okay, so right now you're currently at Westchester Medical Center, correct?
Correct.
All right, and so
But I also work at Metropolitan Hospital in New York City.
Okay.
Both of those hospitals are affiliated with the medical school,
Okay.
which is New York Medical College. And because of the training program, training medical students and residents, we split our, well, at least myself and two other colleagues from the faculty split our time between Westchester and Metropolitan in Manhattan.
Awesome. Awesome. That's great. That's
Yeah,
great. So you saying you said the students. So
right.
education is your wheelhouse.
It
This is what you
is
love.
important, yes,
Yes.
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 Educating students, educating the community as well
Mhm.
about their health, which is
Yes.
something I've been doing throughout my training.
Nice.
Going to different churches, community events, health fairs, whatever is available. You
Mhm.
know, even worked with the American Cancer Society earlier on in my training, especially when it came to screening men for prostate cancer,
Right.
making men aware about their health.
So you said you're affiliated with the
Yeah, the medical school, which is New York Medical College, and the training is between Westchester Medical Center and Metropolitan Hospital, which is an affiliation to the medical school. And because of the structure of training, the residents will go to both hospitals. The medical students will also rotate through these hospitals. And it's not just urology, it's medicine, OBGYN, pediatric,
Oh,
emergency
okay.
medicine.
Okay.
So they're getting exposed to all the different fields. And
Nice.
so they then make up their minds in terms of what specialty area they want to go into. When they're rotating on urology, it's my goal and our goal to convince them that
Mhm.
urology is the best field
Right.
in the
Best
Right.
world.
field,
Right.
yeah.
But some come with what they would like to go into. We try our best to make them aware, and then even if they're not going into urology, we at least try to educate them on some of the common things that a medical doctor will need to see a patient about before sending them to the urologist.
Okay.
Because we're a subspecialty in the field, so a lot of times people refer patients to us. So for students who are going into general medicine, they get a sense, okay, well, if they see a patient that has blood in the urine, need to go to see the urologist.
Okay.
Men urinating frequently, getting up a lot of nights, okay, maybe you need to go see the urologist because it may be a prostate playing a role. So that's how it starts.
Oh, wow. So tell us, how did you start with, and what made you want to go into urology? How did they convince you to go into
Well,
urology?
actually, the person who's going to become the president of the American Medical Association, who's an African American,
Oh,
his
wow.
name is Willie Underwood.
Okay.
He was a year ahead of me in medical school at Syracuse.
Mm-hmm.
And it was essentially, as you're going through this journey, you go through these different specialties. Each rotation is about 6 weeks. You do pediatrics for 6 weeks, general surgery for 6 weeks, orthopedics, radiology. And he just said, like, hey, you need to check out this field. These guys, the surgeons, they're cool, they're calm, they're not hyper, because certain specialties, it's
You're
high
hyper.
strung.
Okay.
General
High
surgery
strung.
especially is one, that's very high strung. So did the rotation, and as they say, the rest is history. Got it, liked it. The personality, very calm. But we still get what we need to get done.
Right. Right.
So,
Right.
so because of Willie, is why I got into urology, and we still
And
see each
loved it
other
since
every
then.
year because the Urology Association has an annual meeting,
Okay.
and that's where you tend to see all your colleagues that you've trained with, and
Yeah.
they've moved all across the country. We try to get to that meeting,
Right.
and the last meeting was in May in Las Vegas.
Awesome. Awesome. So tell us your journey physically, like, what is your testimony on how you take care of yourselves? Because I know, and with talking
Right,
with your wife, how you've made some changes within yourself, with your health and physical well-being.
right. So I mean, it's twofold. For me, I've noticed throughout training, as you're educating patients, they're not fully aware of what's going on, and so if I'm going to tell people about themselves, then I need to also get to that space. So I think this was all during the pandemic where things were really getting out of control. And at Metropolitan Hospital, they actually put in a gym
Okay.
so that this wellness, because
Mhm.
at that time people were stressed, it was difficult. And so the gym was sort of a place for you to get
To
some
get it out.
relax. And so it started there. And for me, just getting down there every day at the end of the day for an hour. And so that's one avenue. Then I believe my wife was looking at, I think it was the University of San Diego or one of those YouTube channel had a community lecture, and I think it was a cardiologist. And like everything else with YouTube, once you look at a particular topic, the next time you log on, there are other things,
Mhm.
and then you look
Mhm.
at it, and you go, maybe let me just look into this. And so it started with listening to the cardiologist, starting to talk about different things, and so then you start incorporating what he's talking about, and then when I'm now talking to patients, I'm trying to educate them about some of those things because for urology, people will come because okay, the stream is not as strong as it used to be. I'm getting up 4 or 5 times a night. There's burning and urination, and I'm not sure what's going on. So they'll come with the assessment, oh, maybe it's a urinary tract infection. And so for us, once we get a urine sample, there's no infection in the urine. So then I have to have a conversation with the patient. Well, if this is not an infection, when you have any symptoms, there's maybe something metabolically going on with your body. So for us, we would always get a urine sample. Within the urine sample, some of the things that are checked is glucose, protein, blood. What? So if a patient shows up and there's glucose in the urine, and you say, "Well, do you have diabetes?" I don't have any diabetes. So then you shouldn't be having glucose in your urine. And then that leads us down a certain path where you start looking into getting certain blood tests, hemoglobin 1C, and see where that is. So that actually started to help us just not focusing on urology, but now the
The
metabolic
whole
problem, the
body.
whole body. And so that's where the education started. So while I'm doing that with the patients, I'm trying to do it for myself as
Yeah.
well. And
Yeah.
so, I think it was as high as 289 pounds at one point, and now to 260.
Mm.
And it's a situation where listening to those folks, and there's several of them, Thursday, I'm
Yeah.
sure I'll list the names of a lot of them, but I can mention them here as well. Well, Jam Das is a cardiologist. There's someone whose profession, he's a pharmacologist. His name is Bobby Price.
Hmm.
And so he
Dr.
talks
Bobby
now,
Price,
right?
my favorite.
Yes. And I think, and so I tell the patients, you got to go and listen to these people
Hmm.
because now they're giving you some insight in terms of the types of stuff you're eating. And then the idea that you may not necessarily need the medication, but if you chart
Right.
changing your lifestyle, eating a
Absolutely.
certain way, this may help.
Hmm.
There's another one, a nephrologist by the name of Jason Fung, and he's sort of the person who sort of advocated intermittent fasting, and just giving people, educating how to eat, when to eat. And then I've just started incorporating every patient that I see. I say, you need to go see a nutritionist,
Hmm.
right? Because so they can get a sense. Some of them will go and they'll come back frustrated. Well, if I don't eat, I'll starve, But I said, it's listening to how they want you to do things. It's portion control, timing, what it is you're eating,
So
so.
awesome. Awesome. Okay. So Tracy, did you have any
I
questions?
did.
Because
I'm
I don't want to. I
sorry.
don't want to. I don't want
I
to.
you talked about symptoms,
Right.
men versus women. Is the treatment the same? Are the what you suggest for a man, is it along the same lines that a woman would have to take, or are there two different
Well,
roads?
that's a good point. Now, so most people, whenever we think of a urologist, most people assume it's a doctor for men
Men.
only.
Yeah.
Hmm.
Yeah.
But women have kidneys, women have a bladder.
Right.
So,
No, because I
yeah,
thought that too until
yeah,
I start researching and looking into it. I'm like, oh, I thought this was a man
right,
thing.
Yeah.
right.
Yeah.
But for women, most of the women go to a gynecologist.
Right.
Okay.
So, but yeah, if you're showing up with pelvic pain, burning and urination, discomfort, a urine study is one of the first things we'll do.
Okay.
Okay, and that's basically to document is there an infection or something else at play. We also get a diagnostic study like an ultrasound, and the purpose of that is to just look at the kidney and look at the bladder. You'll be surprised. Lots of people, you were, born healthy pregnancy with your parents, and then you're going about life, and then something happens, and then suddenly there's a congenital problem that they may not even be
Even
aware of,
though, yeah.
but now it's manifesting itself. So the ultrasound is a basic test we do to look at the kidneys, look at the bladder, and it lets us know if there's anything else at play. If it
Okay.
is just a straightforward infection, we'll treat it with antibiotics. But then there's some patients where there's congenital problems, where there's two ureters on one side, one ureter on one side of the kidney, so there are other things that come into play. Now, interesting enough, when an ultrasound is done, it looks at the kidney on the left side and the right side. And then the liver is on top of the right kidney. So a lot of times when the technician takes images, The liver is imaged. Now, the report comes from the radiologist describing what's going on in the urinary tract, but then they will always say, incidentally noted, fatty liver, hepatic steatosis. So then I see the patients now and I go, well, do you have any diabetes or no? And then you check in A1C and it's elevated, and then they're pre diabetic. And so having pre-diabetes can bring on some of the pelvic pain because the sugar in the urine irritates the urinary tract. So then it's a certain way now to educate them. Listen, and most times when someone has a fatty liver, the first question is, "Do you drink a lot of alcohol?"
Right.
And most people now are, "No, I don't." So then,
Right.
if you're not drinking alcohol and you have fatty liver, that's a metabolic problem from your diet. So now you need to start figuring this out. And I would say, go back to your primary care. Tell them you need to see a nutritionist, and they need to tweak a few things, So there's a lot of teasing out, when
Okay.
someone shows up with a pelvic pain. Men, same thing. They're burning frequency. You try to rule out if it's diabetes. You try to rule out if it's an enlarged prostate. You try to rule out if it's prostate cancer because all of those symptoms sort of overlapped. So then we're doing basic tests, urine tests, a blood test called a PSA, to make sure that it's not an elevated blood test, which then leads us down a totally different path because now you're evaluating the patient for cancer. You look at the urine test. If there's blood in the urine, you go down a different path. Now you need to do a CAT scan because now there may be something going on in the kidneys because a certain amount of red blood cells in the urine can be a sign for cancer. So we just start going down these different avenues trying to sort out what could be the reason why these things are happening.
You said something earlier that you people are referred to you. It's not. I
Right.
wouldn't just automatically go see a urologist. You're a specialist, and
Well,
some of the. Go ahead.
well, no, some people do, and I think based upon your insurance, there's some
Okay.
people that do not need a referral.
Okay.
And so they may be speaking to a friend or a buddy who says, "Oh, I saw the urologist. Your symptoms similar to what
Okay.
mine.
That's
Go
what I
go
was
to the
going to say.
urologist."
Right.
So some people can come and see us
Okay.
without a referral, but most will come with
The
some form of
referral.
referral from a primary care doctor.
But some of the stuff you talked about, shouldn't my primary care doctor have found, even with the diabetes? Like, shouldn't they be checking my A1C? Shouldn't they be checking, my levels and things like that?
Yes, yes, yes. But I think for some patients, depending on their avenue or who they're seeing,
Mhm.
sometimes these things are done, sometimes they're not.
Okay.
And so I find myself, being a bit more committed to doing that. And I think it's probably because of the population that I deal with. I deal with a significant uninsured, undocumented
Okay.
population, especially in Manhattan and metropolitan. So these patients are coming from different places. They go to the emergency room for a problem, and then the emergency room refers them to urology before they even
Okay.
go to their primary care.
Okay.
And so the system sometimes
It's
can be a little
backwards.
bit, yeah,
It's a little
yeah.
backwards.
So we see the patient before they get to a primary care, and then we start the process, and then say you need to go to your primary care. At least that's how I'm been approaching it, so that when they get there, at least things can get started. You know.
One more question before I pass it back to Sean. Age. Is there an age that this usually happens to? Um,
Well, the field of urology, when we think about it, there's adult and there's pediatric urology, right?
Okay.
So they're young kids. Now, teenagers are having some problems.
is that
You know,
common though? I
it
It's
is
probably,
becoming more and more common.
and that's
okay.
And
because of
it,
the overprocessed
right.
foods.
And interestingly enough, our Grand Rounds lecture this past Thursday was actually a topic about erectile dysfunction in adolescent teens.
Wow.
Okay.
Okay, because a lot of these kids, and it's somehow there's some concern of influence from AI being exposed to porn at such an early age,
Oh,
and so
okay.
these kids are now coming in with this concern that they feel that their genitalia doesn't look a certain way, or they think it,
Okay.
so it
Yeah.
leads down to a whole nother path.
Mhm.
So for us kids, young men, could come in with congenital problems. I mean, because for us, we're seeing people, young men with testicular cancer.
Okay.
That can be an issue. There's some young individuals with diabetes, and so they'll come to us a little sooner than. someone that are morbidly obese, and then because of their body habitus, the genital doesn't look as good, they'll send them to the urologist for us to somehow start giving some form of evaluation or education about what they need to do.
Okay.
Yeah.
Wow. Prevention is the key.
Prevention
Well,
is the
Prevention
key.
is the key.
And
my
education.
yeah,
Yeah.
You
my
know?
favorite line to all of the patients is that prevention is better than cure.
Mm-hmm.
Yeah.
That's what I always say to
Yeah.
them as we go through the process. I said,
Mm-hmm.
you need to take a look at these things. You need to be active about it, exercise, diets, and that's why, these different
Workshops.
providers on YouTube. I try to direct them. There's one, I think his name is Bobby Parrish. He
Mhm.
does Flav City,
Mhm.
and so he goes into the stores and educates people
Right.
about the food and
Yes.
the content of it,
Yes.
with the chemicals. And then there's some other apps that are out there, but somehow I find those, at least when I looked at them, to be very informative. And so then I use that as part of
As
my way
part of
to
your
say,
protocol.
to say, listen,
Mhm.
take a look at this. I know sometimes these shows can go for an hour and a half because they're walking through the different aisles,
Mhm.
but then they're clips. So I'll say, if you just want to know about milk, just do Flav City milk,
Mhm.
then Flav City rice,
Yeah.
Right.
Flav City bread. And it's concise, and you get a lot of
Really good
information out of that.
information.
And
Mhm.
So,
sometimes the podcasts are long, but like if you're watching TV, you're in the kitchen making dinner,
right,
put your headphones on and just
Yeah.
listen. You
right,
don't know
Yeah.
what you
right,
don't know.
right,
So you
right.
may educate yourself on some stuff.
Exactly.
Yeah.
So going back to the kids and the adolescents, do you see more of them in your practice? And when you do, what is the response when you say to them, you know, try this, try that,
Mhm.
Well,
or
so for
do,
me, when I see these young men, I try to reassure them it's okay. Now, how do I go about that? I try to get some basic hormone tests, right? Because testosterone is one of the tests we tend to use, and a lot of them now are exposed to the online, testosterone being advertised, so they feel this is something that
they
they
need to
need,
take?
right?
Yeah. Yeah.
So once I do the tests, it's normal. I just say, listen, you're fine. You just need to start
Get off
exercising a
the
little
TV.
bit. Get off the TV,
Stop watching
exercise.
stuff.
Yeah,
Yeah.
because they really get consumed,
Yeah. They
Mm-hmm.
do.
and then if you don't try to have some data to prove to them it's not a problem, they'll just go somewhere else.
Yeah.
So for me, I've just gotten into the habit of saying, okay, I'll do these basic hormone profiles, which is responsible sometimes for arousal, erection, libido, desire. They're normal. I just said, listen, you need to start exercising, going to the gym, doing some other things,
Yeah.
and that will help you in the long
Back up
run.
from the junk.
Yeah.
You know.
And congratulations on losing weight. Like you said, you were 280 something
Yeah.
down to 260 something. That's a great accomplishment.
It is. There was a time, again, and this came up last night, as my college colleagues were trying to tell my wife, well, did you know he ran track? And, and it's like, yeah, well, I've seen pictures of him, because they're all making fun of
Like
the,
it's
Yeah,
unbelievable,
yeah,
right?
yeah.
Yeah.
But throughout high school, we used to do cross country running. So, exercising was always
It's
something.
huge.
When I was in medical school, one of the topics I liked a lot was exercise physiology, because it really, honed in on how I felt about exercising and all that sort of stuff. And interesting enough, you go to medical school with the idea that, oh, maybe I want to be this. I thought I was going to do cardiology. That's what I thought I was going to do
Okay.
until, Willie was like, oh, you need to check out urology. And as I said, the rest is history.
Mm-hmm.
Yeah.
Mm-hmm. Wow.
Yeah, that's nice
Yeah.
that you had somebody to kind of not like kind of steer you in a direction
Right.
other than what you were thinking. So
Right. I
kind of
mean,
like you said for your students, you kind of they go around in different
yeah,
practices.
the mentorship thing is very big
Very
now in
important.
medical school. And, for me, when they're coming into urology, I really try to give them a sense of, listen, this is our organization. There's a certain part on the web page that they're catering to medical students. And what it does, it basically tells them, if you're interested in urology, these are some of the rotations you need to do. You need to be on nephrology. You need to do an ICU rotation so that it prepares you.
Mm-hmm.
I try to direct them to certain organizations that are doing open houses for medical students so that they can hear a little bit more because it's not easy. I mean, I do remember during my time period, a lot of my classmates chose a particular specialty, but then they switched
Mhm.
once they got into the
Into it.
hospitals. Yeah, the
Hmm.
year later, this is not for me. Yeah,
Yeah.
because as you're going through, you're trying to determine lifestyle, pay, you know,
Hmm.
how much the residency period is going to be. Because for urology, it was 6 years. It was one of
Okay.
the longest at the time. Now it's down to 5 years. But you know, general medicine, pediatric, those are 3 to 4 years. And then if you want to specialize, you may need to do an additional year in terms of training. But for the students as they come through, they're going through each rotation every 6 weeks, trying to figure out, okay, is this what I want to do? Is this for me? How much did I get exposed during that 6 week period to determine if this is what I think I want to do for the rest of my life?
Mhm.
It's a pretty tough thing to do.
Yeah.
So I try my best to let them know what the feel is like, and then to have them reach out to other programs, see what they have. A lot of programs now have these open nights. You can just log in on Zoom, and
Oh,
they'll
okay.
they'll tell you what the experience would be like if you were to come to their institution and what they do. So
That's good because it gives them a realistic view.
exactly, exactly.
They're not going in, because cardiology, we think cardiologist, you're gonna make a lot of money.
Right,
I'm
Yeah.
going
right,
into that,
right,
right? But
right,
they're not
right.
real. It's not
They don't
realistic,
see the other
Exactly.
right?
side.
The other
Yeah, when
side.
they go into it and
Yes,
get that hands-on experience,
yes,
where it's like, oh, wait a minute.
yes. It's This is different.
I thought that's what I wanted to
Right,
do.
right.
But what I noticed too, having a conversation with a couple other people, that when they go into their specialty, then they have multiple specialties, or they are become an internist. You know what I
Hmm.
mean? So that their scope is a little bit wider.
Right,
You know, is that something that I know you do urology
right.
and you educate? Is there another part of your practice that you do that's not urology? I mean, because you mentioned, you would say, okay, if they started with you, if a patient started with you, like you said, going backwards, they started
Hmm.
with you, and you say, okay, you should go see your primary. Or
Right.
if they don't have a primary, then and they say to you, I want to stay with you, doc. What happens then?
So urology, it's a unique field again. We're a surgical subspecialty. Now, so for example, a man, he comes, he sees me, he has a kidney stone. I can treat him for the kidney stone. Next, as he ages, he suddenly has problems urinating, not able to urinate well. There are procedures that we can do to treat the prostate. I can treat that same thing. Some men, they'll develop stones in the bladder. I can specifically treat that. They have problems with their scrotum where they're starting to accumulate fluid. It's called a hydrocele. I could be the same person to take care of that as well. So from that perspective, yes. But when it comes to the general health, where one checks your blood pressure, your cholesterol, making sure those things are okay every at least minimum. I tell them if you can see your primary care every 6 months, it's a good first start. Once a year, fine, but twice a year, I think it's even better. That is definitely something that's taken care of by the primary care. I won't really, I will get the labs and then say, listen, this is abnormal. You need to go find a
Right.
primary care. But it's not something that I will then, take
Take
the
on.
responsibility because a
Right.
lot of times they may need some form of medication if they're not, very
Right.
active because the statins. They may need a high blood pressure medication that they need to take for a while until things get. That stuff we usually defer to the primary care. We don't really get into it, even though there are certain blood pressure medications we would use in urology that are known to help prevent kidney stones.
Okay.
So that at those times we may interact with that medication, but general medical annuals, those stuff, we make
Primary.
sure
Primary,
they see their
primary.
primary. Yeah, we make sure they get back to the primary.
Um, you talked about, going back to education, and you're talking about educating being a mentor to future doctors, right?
Right,
What about the men in the community? What about the men in the community? How do you mentor them? I know you said you've been educating
right.
for a while at different churches, and so on and so forth. But how do you take on, not the responsibility, but be a part of healing the
Right,
community? That's
right,
the way I call well, that's what I
right,
call it, right? How do we heal our community, especially our black and brown people that are afraid of the doctors,
right,
first off, right?
right,
Or they wait so long because they're suffering in silence. They know something's wrong, but they don't want to go to they're afraid to go to
right,
the doctor. So
right.
how do you get those people to start thinking more and doing some things that will be beneficial for them?
Well, interestingly, at the hospital, work with a lot of men. Some of them are very active in their church. And so they will always ask me, can you come? And then
Right.
we'll have this, health
Workshop.
fair workshop. And in that setting is where I try my best to let them know, don't be afraid to go see the doctor. These are some of the things you need to do to stay ahead. And again, the urology part is a lot less effective.
Important.
Yeah,
Yeah.
it's hypertension,
Yeah.
diabetes,
Yeah.
depression.
Before they get to you.
Yeah, yeah,
Right.
yeah.
Because they're
So
having all those issues.
right,
And if they
right,
don't want to get to you,
yeah.
these are the things that you have to
Yeah, so
okay.
I'm very heavy emphasizing those things when
The
I do my
yeah.
because it really prevents a lot of these things. So, but for me, getting to the community, a lot of it is through a lot of my coworkers, and they wanted me to come to their churches, even the nurses, women as well.
Right.
They know of certain things, or they have a family member who's a male within their family that's having issues. Can you talk to him? I have a problem. Give him a phone number. I'll call him. There's some people because again, for some folks, depending on their insurance status, and if they can't get to me I said it's fine. Just give me a call. At least I can tell them what it is they're doing,
Right.
what they're going through, and then give them a sense of how they maybe should speak to whomever it is they're
Get
going.
started.
Yeah, just to get things started because it's not easy. The healthcare system is very complex, and for some, access is really
Yeah.
a
Minimal.
problem.
Yeah.
So in New York City at Metropolitan, that hospital does it. But even in Westchester, there's a clinic that I do on Thursday that caters to those patients that do not have
Okay.
coverage.
Okay.
And I do that every week.
They probably have that
Yeah.
here too
Yeah.
in Waterbury
Yeah.
because of
Pretty
the
sure.
But then I think it's a
services.
matter of knowing, right?
Yeah.
Because
Right.
some patients are under the impression if I don't have
I
insurance,
can't go to
I'm not going to go to
hospital.
the
I
Yeah.
can't go to
hospital. And so they
doctor.
then let things get
Hmm.
worse,
Right.
because I'm sure what is it, the Yale system is here,
Yeah.
right?
Yeah.
So
Mm-hmm.
I would be shocked if they don't,
Right.
I would be shocked. But it's a matter of patients knowing where to go, because even within New York, I mean, where Westchester is, we're surrounded by quite a few hospitals. And at least what I've done, because urology is sort of a small field, I've told those guys, listen, if you're not able to take care, just send them to us. Because Westchester is sort of a safety net hospital.
Okay.
So send them, we'll take care of them,
Right.
because unfortunately, we know there's a two-tier system to a certain extent. You can't pay someone who's not going to see you.
Yeah.
And that happens a lot to some of
Yeah.
these people.
It does.
So they come to Westchester, we're there, and we just do
Yeah.
what we need to do to get them back on track.
Yeah.
Do we
Okay.
have a lot of people of color, male and female, that are urologists, or is it really dominated more still by men?
Interesting. Good, very good question because I think the last 2, 3 years in terms of the match process where they have to go through this process to get in, it's been more women than men
Oh,
that
okay.
are going into the
Nice.
field. Yeah.
Okay.
Yes.
Nice.
Yes.
Because women are
So
having
yeah.
a lot of
Yeah.
problems too
Right.
with
Right.
bladder and bladder
Right.
cancer. They say is on the rise.
Yes, it
I know
is.
someone personally that's dealing
Yes.
with bladder
You know.
cancer, but she was, you know, and it took a long time for them to get to that's what it is.
Right.
You know what
Right.
I mean?
Right.
Because
And
I think they think about it as a man,
exactly.
a
A
Exactly.
men's
male
problem.
dominated.
Yeah,
Right.
male problem.
Yeah.
Right. So that was a great question. That
But
was
I
a great
think,
question.
but I think
Yeah.
also for the women, it's helpful because again, society, women may feel more comfortable seeing a female, right?
Right.
It's-
Right.
it can't deny it. It,
Mhm.
it happens.
Mhm.
So I think now within urology, there's a area that's called female urology, right?
Okay.
So, and but there are men who will go into female
Right.
urology as well. But there are a lot of more women
Women.
also
Right.
who are going in there, so that even if a female patient wants to see, because there are women that will say, "Don't you have a female in your practice?"
Right.
Okay.
You know, this
That's
is just
great.
really, yeah. So
Yeah.
we do have that. Also, gynecology. There's this field called urogynecology where it's
They
either someone
specialize.
who trained in urology doing female, or it's someone who's a gynecologist that trained in urology where they do it for an additional year as part of their training. And so that area has also been very helpful in helping women,
Right.
so that they can get the care that they need as well.
That's good to
Nice.
know.
Yeah.
That's good to know
Yeah.
because, like you said, we think of urology for just men.
Men, correct. Correct.
So that's great to know.
Yeah.
I do know some females that go to a urologist that were
Right.
referred,
Right.
by their primary care person. So yeah, that's
Yeah.
great to know. So I'm
Yeah.
hoping that the women that are watching, or trying to scroll by because they're
Right.
like, oh, they're talking
That's
about
not for
men,
me,
right?
right.
Yeah.
Right.
So even the event that we're going to do on Thursday,
Yes.
we are trying to encourage people to come as a family.
Please, all of them.
And so that yes, it's about the men. It's because y'all hard headed,
Right. Well, listen, no question. I mean,
right? And the women usually bring the information
Right.
back to the man,
Right.
right? So
and that's why I gradually over years just started opening it up to both, because the people who would invite me, they had great intentions and they think that the men were going to, and then you will get there.
they
No.
don't show up,
Right. There's a men's group at the church there. You get there.
yeah.
This
And
is,
then the men don't want the women knowing,
and that's the thing. When I told them, forget that.
yeah. And it's
I
like
just,
your wife already
yeah,
knows.
yeah, and I
She already knows, right?
yeah, yes. So
But what
that,
we're doing to hopefully combat that is we're partnering with the fraternity,
right, right,
Omega Sci-Fi
okay,
fraternity. So hopefully they'll be, they'll turn out.
hmm
We'll have. I invited all the guys I know.
Right.
Just 3 guys yesterday, young
Right.
men. I invited them, and they said, "Oh yeah, we saw that." So they're gonna.
Right.
Hopefully they'll show up.
yeah.
And if they don't, that's okay because we'll
Well, hopefully
record.
there's a female that may have gone there that knows
That's
them, and
gonna
they're
go.
gonna get the
Yeah,
information
yeah.
back to them.
I mentioned it to everyone, and I said, yes, it's a men's. It's catering to the men. I said, but this is for the family.
Right.
I said because even if your husband or your significant other, whatever, doesn't come, you're gonna learn something to bring back home.
Exactly.
You're gonna learn something to bring back home.
One of the things I do also now is, because of that whole environment where if there's a man sitting there and he wants to ask a question and there's a woman there, so now I
Get
got
the
these index cards.
yes.
And I tell people just
We'll
write
have
your
it.
questions
Yes.
on,
Yes,
and then
we're
I
gonna
can
have
read
that.
it, and then everyone benefits.
Exactly.
So that you don't have to feel shy about,
And that's what
getting
we're
the
gonna do
answer.
on
Yeah.
Thursday.
Yeah,
Yeah.
because I've just noticed over the years, some want to talk, but then they feel
And
a
then
little
they
bit
get
shy.
you in the corner.
Yeah, then
They-
when you, and then
At
and
the end.
everything goes on,
Yeah.
So yeah,
Good
so
idea. That's
Yeah.
a good idea.
Yeah, that's what we're gonna do. We're gonna have the index cards
Yep.
for people to write
just
their
write their
questions
questions
down.
down. The ones who
Yeah.
are bold, be
Yeah.
free,
Stand
no
up and
problem.
tell
Yeah,
us.
Exactly.
Yeah.
that's not a
Exactly.
problem.
And then also, if you can, if it's not too much, come with some frequently asked questions, or if you know what I mean. If you could tell me what your frequently asked questions
Sure.
would be, or if we can even go over a couple of them now.
I actually have. Well, I have actually flyer
Mhm.
that the medical center put it out in terms of different age groups. What are the things you should be doing or having checked
Okay.
as a patient? So
Okay, you'll bring
I
that
think
with
it's
you.
yeah, I think that is very helpful. I
Okay.
think that's probably one of the best flyers that I feel that when I'm giving out things at a health fair, this is what you need to look at because
Yeah.
it's covering kids all the way until
Oh.
you're an adult into your 60s
Okay.
and the different
Male
things
and female.
yes.
Okay.
Yes.
Awesome.
you know,
That's gonna be great.
Yes.
Okay.
But for the most frequent question, a lot of times it's, the stream is weak. It's not as strong as it used to be. I'm getting up 3, 4 times a night. That's as where in their 50s, they're starting
Mhm.
having these problems. And so it's basic. Listen, just come in, urine tests, a blood test for the prostate. This is a blood test called PSA that we use for screening. There's a lot of controversy about it, earlier on in the 2000s. And because the government has this thing called the United States Task Force Prevention, where they evaluate every screening study that's done to see if it is beneficial for the
Should we
community.
be doing it? At
Should
what
be
age should we be
exactly
Right.
doing
right.
this?
So PSA has gotten a horrible rating. It's a test that's unreliable, right? But I think a lot of it came about because the test is elevated. You do these biopsies, and then we were, in the eyes of a lot of people, we were doing more harm than good, based on the procedures that you were then choosing for a patient of a certain age, right? Because men, as they get older, they claim, in the 80s or 90s, most of them will have some form of prostate cancer, but they'll die of something else before the prostate cancer,
Ah,
right? So that was always a problem. Then, like everything else that happens, a politician gets afflicted with the disease.
Now let's
And
and
then
then
change
the
it,
the
and then the
rules.
lobby
yeah.
Let's
starts.
change the
There are a
rules.
few where that came about, and so now with PSA, it's designed as have a shared discussion with your physician if you want to have it done. Right? But at one point, they were literally we're going to penalize the physicians for ordering this
Yeah.
test. Medicare was going to do
Wow.
that, but then a few politicians, they were very popular ones, they're now not in Congress, but they got ill. Things changed,
They make it
and
part of your preventive
yeah,
workup.
yeah, and so we do it, because when we talk about men and women in prevention, you say, okay, men will do the PSA. I recommend getting the colonoscopy. Those are the two big. Women, they get a mammography, they get a pelvic exam, colonoscopy. Right, those are the big ones, and then some people advocating a screening for lung cancer, with the chest X-ray. So those are the big ones that are out there, and so you try to make sure once I'm seeing someone in their 40s or 50s, listen, start getting these things. Talk to your primary care, so you can get it done.
So when going back to when you said their stream is weak or whatever, how much is that is dehydration?
Well, it could be a part of dehydration, but we will get some of those answers because one of the things we'll do is we'll get an ultrasound, right? So the purpose of the ultrasound, as I tell them, is it's a way for me to objectively see if what you're telling me is what's happening,
Right. Okay.
right? And so there's usually a dimension that's measured on the prostate so that
Okay.
you can have an idea. Well, oh, it's enlarged. There's 20 grams, 30 grams, 50 grams. So the larger the grams, that's probably what's constricting the urethra,
Oh,
where's the
okay.
urine. Now, if that's normal size, then you need to figure out what else is going on. To your point, dehydration. A lot of them constipation.
Right.
That's a
Yeah.
big
That.
one as
Yeah.
well. 'Cause the colon sits behind the bladder. So
Ah.
and so you tell someone get your colon regular, you start urinating much better. So those are some of the things you try to determine. Are they constipated? Are they, as you said to your point, hydrated? But drinking fluids, is important. For us, one of the things that's common is stone disease. You see a lot of people with kidney stone disease,
I have a
and that's
nephew
because of
dealing with
diet,
that. Yeah.
right? A lot of it is because of their diet. And the rule is if someone has kidney stones, we say you need to be drinking minimum 2 liters of water daily. And most people are, I can't drink that. I don't do much. Take your time. Have a liter
Yeah.
Yeah.
My
morning, mid,
nephew is literally going through that, and
Yeah.
he's had like three procedures done.
So the question is now in that setting, have they done what's called a metabolic workup, right? There's a test where you need to urinate into this big brown bottle for 24 hours. Then they send that off, and then it's looking for different things within the urine that can give you a sense of whether, hey,
What
this is
may be
diet
happening?
related.
Yeah.
But then sometimes it could be an organ in the body. There's an organ in near to the neck called the parathyroid that can produces too much calcium in some
Okay.
people. So that's another thing, right? So the diet. If he's seeing a urologist, that's one person. The other person that they should see so they can get a better sense of it is a nephrologist,
Nephrologist.
right? So they're the medical
The
doctors,
kidneys.
yeah, for the kidneys. So it depends. Some urologists will get into the weeds in terms of the metabolic stuff. We do it because again we're in a training program, so
Right.
we're very right.
That makes a
But in
difference.
private practice, I took
No,
care
they're
of your
like,
stone. It's like you go to the nephrologist;
yeah,
they'll take care of that. I don't want
yeah,
to be bothered with that.
yeah.
And so, but the diet thing is key. And that's another area where we strongly will refer patients to a nutritionist. Diabetes is one, so they get that. But when they have stone disease as well, we have booklets, we have literature that tells them. But then I always say, still go to the dietitian,
Right,
to
right.
get better, more detailed assessment of what's going on.
A few
Wow.
times you mentioned PSA. Can you tell the people what PSA means?
Right. So
And
it's prostatic specific antigen, and it's a blood test that's done to check what's going on with the prostate. It's a screening test. Um, it's usually recommended for men over the age of 50. African Americans, we're moving it down to the 40s. Some people do it 45. If you have a strong family history, they'll start in the 40s. And essentially, it's a test to determine if we need to investigate for prostate cancer. But the thing about the PSA as well, you could have a very large prostate, and because it's a large gland, it produces more of that antigen. So that sometimes can cause an elevated PSA as well. And then large prostate can do it, prostate cancer can do it, of the prostate can also cause it to go up. So when you're doing the tests, we do a few basic things. We check the blood tests, we check the urine study at the same time because if there's an infection, that might be the reason why it's elevated. So then you don't start doing all this wild goose chase.
Right.
But if it's elevated and everything else is negative, now we have to determine why is it elevated. And that's when you start doing this evaluation for prostate cancer. And so we then get an MRI of the prostate, and if the MRI shows anything that is suspicious for cancer, then we then talk about doing a biopsy.
So when you talk about your numbers, right? The going up and down. When, like you said, if the prostate is large, it can show that the numbers are up. But if the numbers are up at the beginning of the year and then they're down at the end of the year, and but they're calling it cancer, what happens then? What other type of screening do they do? I know they do the MRI,
Right,
right?
right,
And MRI or um, a more intense test where they see it hasn't metastasized,
right.
and if it hasn't metastasized, then but the numbers are going up, and then the numbers are going down. What could
So,
that be?
but to get the diagnosis of cancer, a biopsy has to be done.
Right? That
Okay,
yeah.
you must have a biopsy, and that's how the pathologist will then read it. Now, before getting to the biopsy, if you see a patient, normal range is between 0 to 4, right? So that's it. You've seen a patient for the first time, it's 5.2. Hey, it's elevated, And I would normally say we can check it again in 3 months, or we can then go get an MRI to see if there's anything suspicious. A lot of them will say, well, maybe I'll repeat it, come back, and then it's down. Okay, and so this is where you're trying to determine, did he have some inflammation? Was there, sometimes if they, have sexual activity and they're coming the next day to do their blood test, the gland is stimulated, the number is elevated.
Oh, okay.
So you didn't say, don't do anything for 2 weeks. Let's check it again, that sort of thing, and you monitor that. And then, but if a guy's in his 50s and he comes in and it's 12 or 14, we're moving forward. This is not about, okay, let's wait and see. Some will say, let's repeat it again, but most times we will then go to the MRI. And then once the MRI is done, there's a certain grading system that the radiologist uses to let us know whether it seems consistent with benign disease or it seems consistent with cancer. And if there are areas where it says suspicious of cancer, that's when I have the discussion. You may benefit from a biopsy. And then from the biopsy, now you go and you do the biopsy. Now it comes back with cancer. The pathologist uses a grading system of the cancer. And so that then determines how you go about making the next step in terms of treating the patient. Because then now we starting having a conversation about removing the prostate or having a radiation as a form of treatment for the prostate disease. And a lot of that is tied into how aggressive the disease is, how many of the biopsy cores that we took were positive, so there's a lot of parameters that we use when it comes to that. Now, about about it being metastasized, the range of the PSA at the initial time will sort of guide us how to go about determining if something is metastasized. So usually they'll say if the PSA is between 0 to 10, it's probably localized. 10 to low risk, 10 to 20 intermediate risk. Anything, if someone comes with a PSA greater than 20, high risk. And so those are the individuals we will start doing the diagnosis, like a PET scan and other studies to see if the disease is metastasized within
Progressed.
the body.
Mm-hmm.
Then we go from there.
I had another question.
They'll come back.
Wait, yeah, right. I had another question. Um, okay, so I'm gonna stay on this subject for
Hmm.
2 seconds. When a person has kidney disease, right, or they're dialysis,
Hmm.
on dialysis, have heart issues in the whole nine, does that affect your PSA? Can that affect your PSA numbers?
Not
Not really.
really. No,
Okay.
for us, it's more checking the urine studies, making sure there's not an infection going on at that time, which can sort of cause the numbers because the prostate is right next to the bladder,
Right.
and so. As I said to patients, the three things that can cause your PSA to go up, it's an enlarged prostate, inflammation, which is called prostatitis, which can happen, and then PS and prostate cancer. Those are the three main things. Now, to your question about kidney disease, when we're seeing these patients and you get a urine test, basic urinalysis, and as I said, we're looking at glucose, protein, blood. If you have protein in the urine, blood in the urine, these are things that signals that you may have some kind of kidney disease going on. And so for me, that's another angle that I use when I'm educating these men when they seem to be either diabetic or pre-diabetic. I said, listen, if you're not careful, you could end up with kidney disease that leads to renal failure, that leads to dialysis. That's what can happen. The next thing I said, you need to see a nephrologist. You need to see an ophthalmologist because of the retina. Those things get affected. And I also insist that they see a podiatrist, a foot doctor, because they have the neuropathy. A lot of them, they'll get up in the morning, hit their feet against the bed. There's a cut. They have no idea how it
They didn't
happened.
know. Yeah.
And that's when I said that's a form of neuropathy. And a lot of them will say, yeah, when I'm sleeping at night, I have this burning. And they said, you need to look at your diabetes. These are some of the things that could be playing a role. So I just said, eye doctor, kidney doctor, foot doctor. You need to see them yearly.
Everybody.
Yeah,
Everybody.
yeah.
Everybody at one
You
time.
need to get it because if not, you're not careful. These things just creeps up on you.
Yeah.
It's very insidious.
But the
So,
other thing is too, I found is they don't communicate together though. You know what I mean? Like the doctors don't communicate together. Where
so yeah,
I'm
no,
not saying you.
no. Your point is valid.
You
And
know,
again, there was a time someone tried to make sure all the electronic medical records were talking together, and that
yeah,
never
they're
happened.
not. It's not
Did not
happening.
happen.
And
So,
so when he goes, when the person goes in and they'll go, "Why are you on this medication?"
right.
It's like you
Yeah.
sent me to
Yeah, exactly.
so and
Exactly.
so,
Yep.
and
Yeah.
Well, I thought
Yeah.
right,
by
exactly.
telling
Yeah.
the doctor though that my PCP is such and such, and I'm
Hmm.
seeing Dr. Fullerton, um, so you guys just don't
Right.
So
But
here's
they'll
automatically
refer
communicate
them.
because I told you, you know what I'm saying? Like
right.
everything's so electronic now.
It's
You could
why.
get
Why
stuff
But the
isn't it
right through
system,
the
connected?
computer.
Right.
right.
Yeah.
But
So why
so
isn't that? I swear I thought
But
that
it's but
happened.
it's but it's being hacked on a regular basis.
well, that's all part of the issue too, right? So two of the biggest, and there's some others, but I'm mentioning the two biggest ones that I'm aware of because I two different institutions. I'm using two different
Oh
EMRs.
wow.
So in Westchester, they use a system called Cerna, which is owned by Oracle. Metropolitan use Epic, right? There are a lot of hospitals throughout the country that seems to use Epic. It's very, provider friendly in terms of the information. You could have seen a doctor in Missouri and then you come to New York and we can just get your consent to us to look at that visit because
Right.
it's there.
Right.
You just have to get permission, open it up, and you can read those notes,
Right.
right? Cerna is the same way, but then within Westchester, for whatever reason, there's some hospitals that don't have the same thing. So it's now the staff has to get the records from the primary care, get it imported into the so that when you do come to see me, we can then read what was done
Right.
elsewhere. It doesn't always happen,
Right.
Right.
unfortunately.
Right.
But they try to make an effort to make sure that information is there so that when you do come, it is. But I get it all the time. Paige. So for me, I basically have a sense of why you're there. I try to make sure I know, but then I always start from that place Some get frustrated. What do you mean? My doctor sent me here, or I don't know
Right.
why I'm here.
Right.
Why you're
Right.
asking me that?
Yeah.
So, but I just want to get a sense. Do you know why you're here? Because some people don't,
Right.
believe it or not. But they say, oh, they told me, or they got a call to come to the doctor.
And
Somewhere
that
this
was it.
weekend, and then they go, yeah, oh, I got
Yeah.
a call to say I need to come see you, but then why?
And nobody asks questions. So that's like one of the main reasons why I like doing workshops and
Right,
education,
right,
because they are afraid to ask questions, or they don't know the questions to ask.
Probably don't know the
yeah,
questions.
Right.
I
They
don't,
don't.
because I don't know. I don't even know
Right.
why I'm sick. I don't know
Right. I
why
don't
I'm
even know why
right.
I'm
here.
here.
Right. And that's where I think
Yeah.
Yeah.
for us and for me, the educating part is key, right? So
Yeah.
I try to say, listen, look at your lab. Your primary doctor did this. This is your A1C. This is what it's been in June. This is what it is a year ago. And
Right.
show them,
Right.
I'm of the mindset of pictures worth 1,000 words.
Yeah,
That's how I
absolutely.
feel,
It's easy to
So,
learn that way
yeah,
too,
yeah,
and it doesn't seem abstract.
right,
And we have to make sure when we are in your office, our primary care's office, we say to them, can you ensure that my next doctor gets these? You're sending me to a specialist. Make sure you're sending the paperwork over. So
Mhm.
I don't have to kind of
Yeah, he'll tell you okay, and then
yeah, yeah.
And then they keep on moving, right?
Yeah.
And so the
yeah.
person that you probably should tell is the person that you're going to make your next appointment with,
Well,
or the nurse.
that's where for in our practice, that's what the rule is. When the clerical staff makes the appointment, you insist you need to get the records,
Hmm.
you need to find out the fax number, get all the HIPAA release
Right,
information in
right.
place so that these things can happen.
Right.
But it can be a problem.
Yeah.
Yeah, no,
I
it can
see
because I
that.
think the last time I went to my primary care and I had blood work, made sure I went at least 2 weeks before. It can't take that long. I get
Mhm.
there and guess what?
Yeah,
They don't
I
even
don't
have
have
it.
your labs.
yeah,
Are you sure you went to the to the? Are you serious right now?
yeah. And
I
so,
know I went to the lab.
Right.
but again, right?
But
One
that's
of the
taking
things I
control
see
of your own self too.
to an extent, but also it depends on where you go, right? Some patients, their insurance will say you can only go to LabCorp,
Right,
Okay.
right.
right? And so a lot of times we try to let the patient go to the lab that's at the hospital because
So
they
you
see
get
I
it.
can see it.
Right.
Right.
Now they can go to Quest, they can go to LabCorp. I think all the practices have an account
With both.
that they with those
Yeah.
places so they can log in.
Right.
So
Right.
it's like now someone has to remember to do that, and so you going in and say, well, I did it at LabCorp. Maybe we'll hit a light bulb for them to know, well, oh, maybe we need to look at because
Yeah.
it didn't come in
Right.
important to the doctor's thing because it's probably still sitting there,
Hmm.
for whatever reason.
But you know
Yeah.
what I like now? Because when I had blood work done, that Quest sends you personally
Yeah.
Well,
your results.
well,
Where
Yeah.
before the doctors would get the results, you wouldn't get your
right.
results.
So the portal is huge,
Yeah.
right? Having the portal. So that's another way now because, again, I will see some patients, and again, their care for their primaries at another institution. They're seeing an endocrinologist somewhere else, whatever for whatever reason. And so now they will have the stuff on their phone and they'll
Yeah.
just
Right.
show
Yep.
it to me.
Yep.
And then I'll just have them try to email it to our office because I don't
Right.
want to duplicate the studies now
Right.
because you just did it
Exactly.
a month ago. Why do I
Right.
need to do it again?
Right.
But yeah, the portal has changed a lot of that as well so that I
That's
can see it in
again
real time.
education because I
Hmm.
don't
Yeah.
have it on my phone, but I have it on my computer at
Right,
work because I
right,
work for an insurance company.
right,
So it comes through there.
right.
Again, that's education to tell people that they
Yeah.
can do that
You
because a
can
lot of
sign
people
up.
don't even know that.
You can
Right.
You know,
exactly.
um,
But the
so
And
portal is
they don't know
huge.
that they have access to it.
Right,
Yeah.
Some
right.
people, and then even if they do, they'll go, "What am I looking at?"
that
Right?
right,
Like,
Yeah,
right.
what am I
Because
looking
it can
at?
say red and green, and that means nothing to me if I
right.
don't know
What it
What it
what it
means.
means.
is.
Right,
Right.
Like
Right.
right,
I don't even know what the blood test was for, let alone
right,
Exactly.
the end result. Yeah,
right.
like I
Exactly.
said,
And
I
that
have a step up because I work in the insurance company,
exactly.
but
And that's the thing, So
ordinary
when
people
you're doing,
don't.
and that's it. I try my best to say, well, the reason why we're doing the A1C is to see if you're pre-diabetic or diabetic. The reason why we're doing the lipid panel is to see if your livers are fine. Because for urology, when we're evaluating men with erectile dysfunction, there's this terminology we call metabolic syndrome, which again is elevated cholesterol, So those things you correct a lot of that, your life gets back on track. You
Yeah.
do some
Yeah.
exercise,
Yeah.
So you try to let them know at least why we're doing this specific blood test to
Hmm.
get an answer, so we can then be a little bit more informed when you come back. Hey, you need to cut back. Look at this,
Right.
and then we go from there.
What I noticed that you've repeated is get exercise.
Yeah,
Right.
right.
So when you're saying that to somebody that walks in, they can barely walk,
Right.
you know, and you say that to them, you know that it's going in one ear and out the other.
Right.
How do you convince them that even if they utilize the stairs in their house, even if they're sitting still, right, but they're using 2 cans of, I don't know, whatever, or a
Right.
bottle of water and just doing this to get
Right.
some type of circulation, some type of movement going? How do you convince them?
Well, I think part of it again is discussing why
Why it's
you are in the
important.
position in it, right? And from where exercise comes with regards to your heart, you know. And for me, I go, listen, find out if your insurance gives you coverage to rehab. And
Oh,
tell your primary
okay.
care to refer you to the rehab facility and let them
There you
get you
go.
started.
Yeah.
Right? This is one way to get
Yeah.
started. Not
Right.
everyone have that. You know, I know some of the churches that I've gone to, I know the men's group have this thing where they will meet up together and they'll walk in the park.
Mm-hmm.
They'll meet up on a Saturday morning. And so that's one way they do it as a group,
Mm-hmm.
you know. But yeah, I try to figure out ways that they can get to just get referred to rehab, go there for 3, 4 sessions, learn something, and then see if you can, you
Right.
know, but because it's not easy. I
Right.
mean, for some of them, based on their lifestyle, you know, some of them literally just depressed
Yeah.
because of what's going on, so they don't have the means
Right.
to get to that. But I said just basic walking. You can start with 30 minutes a day. You can gradually get it
You
to an
know, 30
hour.
minutes is a lot for some
Yeah,
people.
it is.
I'll
No,
go
it
5 minutes.
Yeah,
Or
you
put
know.
your hype song on.
Right.
That's what I'll go.
You
Listen,
know.
because exercise for me is not my best.
Right,
I
right.
just that's me,
Yeah.
right? So I understand when
Right.
somebody goes, no, I don't
Right.
want to go to the gym.
Right.
I don't want to do. She's a gym rat. I'm
Right.
not.
Right.
She's like, you need. No, I'm not coming.
That's my happy place.
Mhm.
That's
Right. And that's the thing,
that's my
right?
happy place.
But and that's what it does, right?
Yeah.
It increases those dopamine,
Mhm.
Exactly.
the hormones, the happy hormones.
Right.
It increases that, and people don't even understand that.
They
Well,
don't.
And to that point, right? So you get into the space again with the YouTube. All right, one of the guys, a neuroscientist, I think he's from Stanford. His name is Andrew Huberman. So I'll tell patients just listen to him. He gives you some basic things, how you can get started the day, the sunlight. You know, these are some of the basic things, and then exercise. Because one of the things I've noticed. So he's a neuroscientist. Bobby Price is a pharmacologist.
Pharmacologist. Yep.
Jason Fallon is a nephrologist. Jamdas is a cardiologist. And then there's another guy that I've seen. His name is Sten Ekberg. I think he's a holistic doctor, but he used to be a triathlete. All 5 of these people are talking about the same thing, and they're different disciplines.
Mm-hmm.
It all goes back to hypertension, diabetes, exercise.
Same
It's
stuff.
unbelievable. Unbelievable. You know,
That's
so
all preventable.
yeah,
That's all
Yeah.
preventable.
you know, so
But when you have like when you have the systems that are in place,
fragmented, yes, it's fragmented.
you know,
It
But
is fragmented.
one thing I want to say, and I'm not promoting gym,
Why
but
not?
You should.
well, because you can do it at home. I
Right.
do love the gym, but you can do it at home, like you said, walking in the kitchen, standing in front of the TV. I've done it. You know,
Right.
it's been messy outside. I didn't want to go outside. I turned on my show,
Right.
walking, doing whatever in front of the TV. But a lot of things that people don't know too with their insurance companies. Not every insurance company. This is not a
Right.
blanket statement. Your insurance company will pay for you
Oh, yeah.
to have a gym
I,
membership.
I tell them all to look into that
And
because I know that.
and people don't even realize
Right.
that. You don't even know what you have at your
Right.
hands
Right.
because
Right.
you don't know. Again,
Right.
I say you don't know what you don't know. So people should really look into that.
And that's where I think the workshops are supposed to be
Yeah,
helpful. You know,
absolutely.
hopefully you have
For
someone there at
resources.
that place to give them some insight.
Yes.
Say, hey, look into this.
The-
You know?
Yeah.
The other
Yeah.
thing too is when you're at a certain age, and you don't have to be 70. You can be
Right.
60, and you qualify for silver sneakers,
Right.
which you can go to the Y for free.
Yeah.
You know,
Right.
and
Right.
if you're
Again, people don't know that.
exactly.
Yeah.
And
Right.
also if you are disabled, if
Yes.
you're considered disabled or and can prove that you are
Right.
type of thing, you
Right.
can also go to the Y for free.
Absolutely.
They,
Absolutely.
you know, so yeah, this is
Yeah.
You know.
if you don't
Definitely
know,
educational
now you
and
know.
informational.
Yes,
you know.
yes. I can't wait for Thursday.
Yeah.
Because those that are listening, those that are watching, you know, come on down. You don't have it's for male or females, for the whole family. Come on down because this information it needs to be you know, and
Right.
we're gonna have a fitness instructor.
Right.
speaking about labels
Right.
and nutrition. And also, we're going to do some exercise,
Yeah,
some simple
sure.
things.
Sure.
We're going to have healthy choice foods
Sure.
to try.
Food,
And
I'm in. No.
yeah, right? Healthy food to try. And also, some drinks, some easy recipes that you can do at home that is going to be, one of the ways that you can get started.
To the food point, the other thing that I've actually got people into as well, and I suggest, and again, it's just listening to these folks on the YouTube, is the continuous glucose monitor,
Okay.
right? So now, most people, if you have diabetes, your physician is able to write a prescription for it. There's one brand there that sells it where you don't need to have a prescription, but it's FDA approved. It's Stelo, Stelo. All right, it's and it sells you two. Each one lasts for about 2 weeks. And again, it stemmed from listening to Bobby Parrish, the guy at Flav City. He puts it on, and you can just see what goes on in your body with the food you eat.
Okay.
I mean, I've tried it now. I think four of them I've used over the period of time, and I remembered long day at work. At the end of the day, started at 6:30, 7:30. Say, well, I need to eat something. Go to the cafeteria. I remember having it on, and there's fries, there's nuggets. Okay, well, I'm
This
hungry.
is what I'm going to eat.
Yeah,
I'm going to eat it.
and I swear, within an hour or two, you saw the sugar just spiking up on this monitor. Right now, doing that and not knowing, right? And so someone then has a meal in the morning, whatever it is for breakfast. 4 hours later, they're eating lunch, not knowing that what you just ate for breakfast is probably not even out of your stomach as yet,
Right.
and you're adding more
Didn't
sugar.
even digest.
Yeah, not that,
Mhm.
and it was an eye opener. Another time I saw it again, and this is again, someone that was very close to me got me into this. I'm not a big Starbucks person, and he's like, "Oh, just get the latte with 4 pumps
Oh
of
my
syrup,
goodness.
so
That's
vanilla."
nothing but sugar.
Oh my goodness.
Nothing
But
but.
it was
It tastes good, right?
it did, but it was very revealing to me what was happening,
was it?
Yeah.
right? And so
And
then
how quickly it
yeah,
happens.
that's why I had to look this up. And I was like, man, why is this? I'm having matcha tea with almond milk, even though the almond milk is a problem based on
Yeah.
listening to Bobby.
Ingredients.
But
Yep.
I'm going, okay, I'm going with
We
that.
won't even go.
But the syrup, each pump, I forgot, was like, I don't know how many grams of teaspoons
Sugar.
of sugar.
Yeah.
So you multiply that. This is a problem.
Yeah.
These same environments, tell someone to look at a can of Pepsi. It's like 38 grams of sugar in a can
And
of
that
Pepsi.
little
I do a
can.
class
know.
called Sugar Blues,
Right.
and I have the bottles, and do the
Right.
measurements of the
Right.
sugar, and each bottle has all that sugar in the bottom of.
Yeah.
And when I do that class, they're like, I said, would you just take that to would you just drink the sugar like
Right.
that?
Right.
And they're looking at me. No, who's gonna do that? I said,
Right.
what you doing it?
That's exactly.
Every time you drink
Yep.
ginger ale that has no ginger
Yeah.
in it.
Yeah.
How about that?
Yeah.
That's a whole different story.
Yeah,
But the sugar, and then it's added sugar.
Right. Right. And that's
So-
so the educating and
Yes.
understanding what that means, because
Yeah.
with the diabetics and the pre-diabetes patients, that's the other issue. So I'm always able to convince them and say, listen, the urine test does not show an infection. Why am I getting up 4 or 5 times and not having burning?
Yep.
What are you eating? And then you get into that. What are you drinking? Coffee, tea, juices,
Sodas.
alcohol, all that stuff. You got to stop drinking those in the evening, because then what happens, as I explained to them, insulin now has to be secreted because that's the storage hormone to take the glucose down. But at the same time, when that's happening, it blocks a hormone that the kidney makes that is responsible for retaining
To
fluid
take
at
it
night,
out, right.
which is ADH. And it's a vicious cycle.
Yeah.
And so that's why they have the frequency, the urgency, simply cut those things out, stop drinking fluids at least 2 hours before bedtime, see what happens, and that changes it, because there was a time we would go, oh, it's your prostate. And, the ultrasound would say it's enlarged. Oh, you need to have a procedure in your prostate. You do the procedure, and the guy's still having the same
Yeah,
problems. Then
yeah.
you know,
So then you know
that's
that's not it.
That's not it.
That's not it.
So there's a pill that we give them called Flomax, that is designed to work on the prostate. If I give you Flomax and you come back and tell me 2, 3 weeks, that didn't help me, then your prostate is not the problem. I
Okay.
need to start thinking, what else is at play here before we actually think, that
And they
maybe.
don't believe.
I know,
They
because
don't
they
believe
want
their
something.
food or their drink could be the problem.
But that's why I direct him to those guys now.
Yeah.
You got to listen to Flav
Yeah.
City. You go listen to what they're saying.
Yeah.
It's real. They're giving you some insights, and let the glucose monitor. You want to put it on and you'll see. Just go ahead and do what you're doing, and then you'll see that stuff, and then it will hopefully
Be an
tweak
eye
the way
opener
you.
for you.
Yeah, yeah,
Now, does the monitor have a needle to it?
yeah. That's a little smaller than
Oh,
you. Yeah,
okay.
Go put it back to the
Because I
fatty
said I was
side.
going to try it.
Yeah.
Mm,
And it's
I
not
don't
it's
know.
not that bad. It's not as if
Okay.
when the needle goes in, you're feeling this,
Yes, okay.
yeah.
You didn't even try
Yeah.
it, and you're doubting
I
it.
know.
Yeah,
I thought about it because I thought about it for my
Mhm.
own self to just
Yeah,
experiment to
it
see.
is.
You know what I
It's
mean?
not a bad idea.
Yeah. I just thought about it. That's all. And I always wanted to ask that question.
Little small needle, he said.
Yeah.
Yeah, no, it's very tiny, but I mean,
I think
it
he would
What are
Let's
the
do it.
benefits? We
Let's do
can.
it.
What are the benefits outweigh the
benefits-
fear?
Oh,
So
yeah.
let's do it.
Right.
All right, we're gonna. Yeah,
Yeah,
we're gonna do it, and we'll let
now-
you guys know.
Yeah.
Yeah, because even some of the chocolate that Bobby talks about and stuff, you take it and you can just see your sugar just stays the same.
Yeah,
It doesn't go up.
Yeah.
It's
it's
it's an eye opener.
Yeah.
I really think, and I think for most people, if they can get that sense of what it is that they're putting in their body and then seeing the impact of it, maybe it gives them a different view.
yeah.
Because as you said, for some, they don't believe this is what's doing it.
Right. Because
so-
I've been drinking soda all my life.
exactly
Just like I've been
exactly.
smoking all my life, type of
Exactly,
thing,
right,
right? I've been
right,
drinking all my
right,
life,
right.
but your health is declining. You don't think any of that has
It is, right.
anything- You haven't
You know.
even tried anything different,
Yeah.
to stay away from it.
It's funny you said. I saw I saw a patient this past week, and he's just coming for general checkup. He's in his 70s, and he said, "I just want to make sure my prostate is fine and my health is good. My mom and my family, they live into the hundreds." And so I started saying to him, "Well, we'll check the PSA, do these things, and exercise because my mom is 95. She says exercise is overrated."
And she's probably very active, right?
So I looked at him. I go, "Well, at 95, she's entitled to say whatever she
Yeah,
wants."
she
But I'm
is.
telling you,
Absolutely.
you need to
You
do
need
it.
to
Okay.
exercise.
Yeah, because you're not 95
Right,
yet.
yeah.
Yeah. Wow. This was great. This
yeah,
was
very,
enlightening.
very informative. So
Mhm. Enlightening.
hopefully they listen and take something away.
Yeah.
And they see you guys on Thursday too.
Yes.
My goal is, I will say to them, I want you to be an advocate for your health,
For yourself.
right? You've got to know these numbers, basic cholesterol, good cholesterol, bad cholesterol. You need to know what those things mean, right? Understand what it means, how it impacts you, because the foods that you're eating, it plays a role with that stuff. So,
Disease starts in the gut.
it does. It does. And
Starts
so,
in the gut.
and that's why, for us, as I said, for urology, we're trying to look at your kidney and your bladder, your prostate, but that liver just sits over the right kidney, and the radiologist and they make comments about it because it's an organ and it's part of the image that they got.
Right.
And they say, hey, this
And you're
stuff's
not
because-"
getting like the symptoms.
Right.
The symptoms are, but everything is connected
It
too.
is.
And
It is.
people don't
Right.
realize that.
Right.
Everything, your whole body, one part of your body can't function without the
Without
other.
it, that's a fact.
And so when you go into different specialists and they only concentrate on this thing,
Which is
and
an
they're not
unfortunate thing,
right,
yeah.
but they're not enlightened like yourself,
Right,
where
right.
you look at the whole body. You're
Yes.
not just urology is your specialty, but you look at the whole body. How did you get to me?
Right.
You know what I mean?
Right,
And
right.
most doctors, I won't say that. I'm sorry.
Right.
I'm not.
Well, just say providers.
But providers,
Yeah, in
providers,
general, yeah.
basically, if they're not interested
Mhm.
in learning about the whole body and how it affects their patients and giving them the education they need for
Mm-hmm. Right.
preventive care
Right.
before they see them or
Right.
while they're seeing them, because there's a lot of these things that can be reversed or
Yep.
reduced
Yep.
where you will feel better.
Yep.
But when you have a person that says, I always had this, or I always had that, and my father did, and my mother did, or whatever, they don't understand. It's because the way you grew up, you eat the same way
Similar.
that you grew
Sure,
up.
Sure.
And then with society now and the sad diet, right? The sad diet is over processed food. So the food that our parents where we grew up, because we're
Right.
all in our 50s or younger,
Right.
uh, or older, whatever.
So I'm one
when,
year older.
1 year, right? So when you are when we think about when we ate then, like even just the peanut butter that we
Right.
had when we were kids, it
Right.
was peanut butter,
Right.
salt,
Mm-hmm.
and it, not even oil added,
Right.
because peanut butter peanuts make their
Right.
own oil.
Right.
But when you're looking at peanut butter now, how many ingredients are in that? You know what I mean? So we're being hijacked.
Yeah. Yeah.
We're
Yeah.
being hijacked and programmed
Yeah.
by our food, and people don't understand that. So it's like hard. It's not hard, but this is why these workshops
Yeah.
and the podcasts and these conversations are so
Right.
important, because it makes people think a little differently, or they go, oh,
It gives them
yeah,
awareness.
yeah.
Right.
Oh, yeah, you're right. Oh,
Mhm.
yeah, I did. That used to happen. Oh, it could be that.
Right.
Oh, I drink a case of doggone Pepsi
Mm-hmm.
in a week.
Yeah.
And they don't understand that could be one of the culprits of why they're dealing with, because they're getting the sodium from the
Right.
Pepsi and the sugar from the Pepsi.
Right.
We won't even talk about the dyes,
Right.
and the other ingredients. But yeah, that's
Well, to that point again, there are few documentaries on Netflix
yeah. Oh
that
yeah.
really goes into some of
Oh
these
yeah.
things. I mean, the one that I remember the most, and try to guide it at the church where the youth groups and stuff was Super Size.
Yeah.
That was the one that I remember showing to the kids at
With
the
the
church.
McDonald's and
Yeah, with the
stuff.
McDonald's and what
Yeah.
happened to that
Mhm.
individual and the types of food. But there are others out there
Mhm.
where they go
We gotta
into
I'm
that
gonna
sort of
pull that
stuff.
list together, because
Yeah.
when I'm working with clients, I
Yeah.
give them mandatory
Right.
YouTube videos to watch.
Yeah. Yeah.
Mhm.
But there are
Not
quite a
YouTube,
few.
Netflix.
Netflix,
Mhm.
yeah, there are
Mhm.
definitely some very educational ones there on Netflix that could really open your eyes again, and the apps, right? The
Yeah.
apps on the phone, and
Mm.
so when you're in
Yuka.
the store, you
Yeah.
could and just scan it,
EW.
just give you some sense
Exactly.
where things are, what you're getting, and then hopefully that do the exercise, and,
But
and
they
that
got to be
journey
open to
starts.
it.
Yeah.
They got
Yeah,
to be
It's
open
it's
to
a
it,
yeah,
lifestyle
because I
change. It's
would,
not
yeah,
temporary. It's a
right.
lifestyle change.
Well, what do we say? What do we
yeah. Well,
say?
I mean, like I said, I don't scare anyone,
If you
right?
don't
But
take care of your body, where you gonna
Where you
live?
gonna live?
right,
Where you gonna live?
right,
And then I also say change happens one day, 1 hour, 1 minute
sure,
at a time.
sure.
One thing at a time. Everything because if you've been suffering for 30 years, it's gonna take 30 years
Oh my
to get
gosh,
back,
yes,
right?
yes.
It's gonna take 30 years, and then when I talk to people and they're talking about they've been on this medication forever, but you still have high blood pressure.
Why?
The
Yeah.
medication's not doing what it does at the moment,
Mm-hmm.
but it's temporary.
Right.
And so, what are you going to do about it? Because you can, support your body's natural healing process.
To that point, I always insist you need to get a blood pressure
Blood pressure.
monitor, have a cuff, so that when you're home, because for some patients, they come to the doctor and then it's measured at that moment. They see that, oh, it's high.
Mm,
You need a pill. But if you're there during the week at home and you check it, you can go back and show them what's going on for a week or two.
right, right.
Maybe
When you're
they can,
relaxed,
yeah,
because they
and then
got
maybe
that white coat syndrome.
right, right. So then maybe they can cut it, stop it, and then if you're serious about doing certain things, some of these things you may not need to be on these medications, but it's a two-way street.
It's a
You
two-way
just,
street.
But I always say you should have a blood pressure monitor cuff at home if you have high blood
To check
pressure,
it, yeah.
and just check it. So
And also too, checking it at certain times of the day.
correct.
Because it can
That's what I
be
was gonna say. How
yeah.
often should you check it?
In the
And
morning,
what time?
before you get up, you start your day, right? Even
Mhm.
before you take the pills, see what it is, and that's where, again, the monitor shows up. You'll see what's going on with your sugar
right.
in the morning. And then the question then becomes, do you need to be eating breakfast now? If you have this sugar in the body, it's giving you the energy to do your stuff. And that's where the intermittent fasting
Fasting,
comes
yes.
in, so, but, you have these discussions with your provider, seeing a nutritionist, get into exercise. I think
Yeah.
all that stuff hopefully,
Makes a difference.
helps, makes a
Yeah.
difference.
The other thing too that can be very important that I always try to stress with people is write down what you eat for 2 weeks.
Right.
Just
Right.
write down, even if it's a stick of gum.
Mhm.
Write down what you eat for 2 weeks, even with the monitor. With
But
the
yeah,
monitor
but there's
too.
there's a place for you to put what you're
Yeah.
eating at a time, and it's
Okay.
all there.
With the
Yeah,
monitor.
yeah.
Okay.
You can put it in, and then you'll see,
Yeah.
where
Okay.
things are going. Yeah,
Yeah, because that brings awareness of first, because the first thing people say is, "Oh, I don't eat that much of this, or I don't
right,
eat that much of that." But once you measure it, once you are paying attention, you realize you eat, you know,
Yes.
you have maybe 5 coffees in a day when you always say, I only have two.
Right.
But technically you're having five in the
It
day
is. Yeah.
because you're measuring it now and you
Right.
realize, wow, I'm
Yeah.
really
I
eating
log.
this
It can be very addicting though too.
to log.
I log.
Yeah,
Yeah,
Yeah.
that's
I
great.
do. I
But
log.
does
It can be very addicting. Uh,
I was gonna say, what
it could be
changes are you
addicting.
making?
Yeah.
It could
But
be addicting.
what do you mean addicting to what? Addicting.
To log when you're logging every day, your breakfast, your lunch, little stuff that you
Mm-hmm.
do,
Mm-hmm.
it gets to be addicting. And I know for me,
You
I
start
hold my feet to the
micromanaging everything. Yeah.
I hold my feet to the
Yeah.
fire to the point where it gets to I'm saying, why are you doing
Well, I
No,
think,
but
for me, I think it's a matter of giving you a sense of where things are so that, okay, this phase of the year now, Thanksgiving, Christmas,
mm-hmm,
right? You're probably going to go off, but then
mm-hmm,
you don't feel guilty about it
right,
because you know what it does, but then you're going to get back on track.
right.
To
this?
me, it's just giving you a
Being
sense. So,
awareness.
yeah, so then you don't feel guilty. Okay, because I won't tell you what I ate yesterday, but I know what I'm doing today. I'm an
Right,
addict. I'm gonna exercise. I'm gonna
Right.
fast.
right.
Get back on track.
And
But
you
I just did what I
Yeah.
had to do yesterday.
so
So
so when you're talking about it's addictive, when you're looking at what you're eating, are you making a change of what you're eating, or
I
you're
don't eat
just
bad, but when
okay?
I go off, I feel guilty.
Okay,
that's
Like
the thing.
I had
yeah.
a day yesterday where
Eat what you
I
ate.
had pasta and I haven't had pasta in 2 months,
Right, but you're not gonna
but
do it again tomorrow.
I'm gonna do it again today because I have leftovers.
Right,
But
exactly.
I'm already thinking I don't need to eat this. You know what I mean? Because I didn't even eat much of it
Right,
and I felt
right,
full.
right, right,
So that's why I
Wow.
say it can be addicting. So you got to make it work for you too.
right.
It
Yeah, but
sounds easy to log, but
yeah,
it's
but I
kind of
think
like
that
getting
the
on the
guilt.
scale every day. I
Right,
don't need to get on
right.
the scale
Yeah.
every day. But
No.
guess
Yeah,
what I do
but
every
but
morning?
but I do that too. I actually do
Stay
that.
off the scale
No,
because the
I
number
do.
is not it.
I do it, but it gives you a sense
It
of where
does.
things
But it
are.
messes with your psyche too.
It does. Because I'm like,
For some
what?
Yeah,
people, it depends. It's
yeah.
an
No,
individual
it
thing.
does.
True,
It's an
true,
It
individual
does.
thing
true.
because if
Yeah,
you're getting, I'm finding with myself, if I'm weighing myself every day, or yeah, if I weigh
hmm
myself every day, it's gonna fluctuate,
it does.
right? It's
It
gonna
does.
fluctuate.
You know.
But when it fluctuates more than 1 pound or 2 pounds, then you look and you go, what did I have yesterday? Or, so on and so
But
forth. Or I'm bloated.
right,
We'll
right.
Yeah,
use
but
that
in
excuse.
24 hours, that's not true, right? Her
What?
scale's not going to change from what
You
she ate
can
It
based on you
can.
yesterday.
can
Yes,
based
it
on what you're
can.
eating, and then of course
And
your
if you're
hydration
fluid,
status.
right? And I
That's
was
the
gonna say,
critical one.
yeah,
Because they will tell you the first 3 pounds that you lose is usually water weight.
Water.
yeah.
So
If you're retaining water,
yeah. So I use it, and because I can tell in the morning before I start the day, and then I go to work. I'm fasting throughout the whole day. I don't eat, and then I come back in the evening. I could get on still, and you can see there's a drop.
mm-hmm.
Hmm.
Now they'll say some of the YouTube providers will say, during the day, drink some water, have some little bit of Himalayan salt in
Salt
the
in it,
water.
yeah.
So there are
To
ways to stay hydrated
mm,
and not feel like you're just draining yourself.
right,
Yeah.
So yeah,
yeah.
I think there's just
I got to
different ways
push
to
away from
approach
the
it.
scale. The scale
Yeah,
is not my friend, and
yeah.
it's not the
But is it
determination.
because you're on the mindset I need to be at this now?
I don't have a number in mind.
Right.
So when I don't see it going down, I beat myself up. But I know that I exercise and I eat good. I'm not perfect, don't get me
Right.
wrong.
Right.
So
Right.
I know that should not be my gauge. The scale
Right.
really should not be for me, you
Right.
know? Um,
Well, no, I think it's fair point, but I think when we're now getting into this discussion about the body mass index, the BMI, that's another thing where they're talking
I don't
about
like
your
that.
risk. I know, but somebody came up with it to help focus
Yeah. Is
away.
it
So
realistic though? I
no,
mean, you're a
no,
doctor. I don't know if
no.
it's realistic. You can't
Well,
tell somebody that's 5'2" you need to be 100 pounds.
right, right.
You know what I'm saying?
Well, this is
Uh,
all these actuarial stuff, insurance company
Right,
that's
right.
you're a part of.
Yeah, yeah.
They
no,
came
I
up
don't
with some of
own
these
it
things.
now.
I know. There's this other thing, they call the waist to hip ratio. If it's over a certain
Yeah.
amount, then, your risk is increased. Some folks talk about if you stand against the wall and you look down to see your feet, and if you can't see your
It's your
feet,
feet.
that's a
There's a
problem,
problem.
right? So then they're talking about visceral obesity, the
Visceral
abdominal
fat.
stuff, visceral fat. And
Hmm.
so how do you go about it? And I think to me, one of the best persons that really talks about it is Jason Found with this whole intermittent fasting and how you can reduce that stuff, as you go forward. It's not an easy thing.
Yeah.
It is not an easy thing at all. But I think, as you're trying to figure out, because they'll always tell you that's the last place to go is the abdominal visceral. That's the last. The face looks good, the arms good, the thighs, but that's where you need to put in some work,
Yeah.
as you go on that journey. But
And it's a journey.
it is.
Absolutely.
But I
it's a
think,
It
like
journey.
you
is.
said before, it's really diet. I could exercise all day. I could go to the
Hmm.
gym 7 days a week, and if I'm not,
But if
if
you're
I'm
not
going
putting
home
that
and not
right,
eating right, it's
absolutely,
Or
it's a
going through the
waste.
drive-through
yeah,
on your way home.
absolutely,
Yeah, it's a
yep,
waste.
Mm-hmm.
yep,
Wow.
Definitely. So,
This is great.
yep.
This is great.
awesome information.
All right. We can keep going.
Oh yeah,
We
that's
can
that's
keep
it.
going.
We're
That's
gonna
it.
But
hijack. We
yeah.
Thursday what? No.
Yeah. No, I'm looking forward to that,
Yeah.
because that's one of the places I try my best to make sure people understand. Because, going to the physician and not knowing what's going on with your body, or it's just, oh, your labs are fine. But then there's one that
Right.
is a little elevated, but, it's a subtle thing that can happen later on. Your
Right.
triglycerides are high. Why is my triglycerides? Because of what you're eating, too much sugar, so. I
And
don't. I just try my best to give as much information about
Educate.
what's going on. Yeah, so they
right.
can then be more proactive.
And then the other thing is when their labs come back and they
Hmm.
say it's fine, but they're feeling something different.
Right.
They have to keep asking questions.
What's
They
going
got
on?
to keep
Yep.
saying to the doctor, but something is going on.
So to to that point, for us again, urology. There's a lot of men, young men, who will come and they have this lower back pain, and the pain is somehow felt in their genital areas. So we get involved, get an ultrasound to look at the genitals. Everything is normal, but they're still complaining there's something going on down there. So now my thing is, well, if there's nothing here, I need to figure out where else it's coming from. And a lot of time, it's coming from the
Kidney
spine.
or
Well, no, no,
the
the
spine.
lower spine, because
Okay.
of the nerves. They have herniated disc. They're doing
Mm.
these manual labor jobs in their lower spine. They have a herniated disc 2, 3 levels. That nerve gets pinched. That's what's responsible for going to that part of the area. Same thing with constipation. They have these lower back pain, the nerves that are going to the spine, that goes to the colon. It's the same set of nerves that goes over to the bladder and the prostate. They're all intertwined. It's a plexus. You figure that out, this problem gets corrected.
Okay.
But a lot of times, there's this annoying groin pain, discomfort. What is going on? But the ultrasound is normal. There's nothing for me to do here. I now need to go, as you said, it's all interconnected.
Mm-hmm. Mm-hmm.
So the lumbar spine is also critical in terms of the nerves and how it innervates the lower part of the body.
So what is your take on a chiropractor
I think
in
there's a
the
place. I
in a
think there's a place
situation
for
like
it.
that?
Yeah,
Yeah.
I think there's a
Mhm.
place. I think there's a place for it. I mean,
Okay.
you can go. And again, they're going to be a little bit more holistic in their approach
Mm-hmm.
as well.
Mm-hmm.
So seeing that individual first and seeing how that works, I think
Yeah.
it's fine. I
Absolutely.
think that's fine.
You were gonna say something, Joe?
No.
Oh,
No,
okay.
no. I'm
Okay.
good.
All right. Well, listen, like I said, we can keep going and we can
Mm.
keep going. But we're gonna
We
wrap
gotta
it
save
up.
some
All
some
right.
Yeah. We
information
gotta
for
say
Thursday.
That's right.
Yes,
Oh,
yes.
that's it. Looking forward to it.
Yeah,
Looking
and,
forward
and
to
it's
it.
gonna be interactive.
Yes.
We're
Yes.
gonna we want to make sure that it's interactive. So thank you. Thank
Yes.
you. This
Pleasure.
was
Thank you
very
for
much.
having
great.
me. It
Yes.
really was a
Yeah.
pleasure.
I
you
feel
know.
like we need to make a series. I don't know. We'll
We
talk
got
off.
we
We'll
got a lot
talk
of series
offline,
going
right?
on.
I know,
Uh,
but I think it's so important, and especially for our audience because we sprinkle men in.
Right.
You know
Yeah.
what I
Right.
mean? So
Right.
this month is
Yeah, I
all
know.
men.
Yes.
So
Yes.
Yes.
I'm excited about that to
Yeah.
see, if the listeners, if they are gonna,
Hmm.
really take some information
Yes.
from what you're saying and applying it. So
To
we'll
their
have
daily life.
those different resources that you
Yep.
mentioned. We'll have it in the description. And listen, come out Thursday, November 13th at the North End Recreation Center, 238 North Main Street, and it's from 6 to 8 p.m. And yes, you'll meet the doc in person,
Yes.
live and in person, and you will, learn some things. Just come down to learn how you can help yourself or somebody else,
Mhm.
Yes.
and bring the young men
Yes.
also
Yes.
because, like you said, if the young adolescents
Yep.
are having problems, then yeah,
Yes.
bring them in too, because they go to mom. They don't go to
Right.
dad and say, "Hey,
Right.
this is what's
Right.
happening." They
Right.
usually go to mom because
Right.
they're like, "Ugh, I don't want to go to
Yeah.
daddy and tell him this,"
And
right?
and to that point again with Flav City, when he talks about the chemicals that are in some of the products and that we're using, and then we're seeing these young men again for urology, we're evaluating for infertility. They're
Oh
having
wow.
difficulties having children. Want to know
Oh,
why? Yep. So, so because
listen, you just brought up another topic.
yes,
Okay.
so yeah, so infertility is another area where for a lot of young men, when we're evaluating them, you start trying to figure out reasons,
Hmm.
Mm.
causes,
Yeah, because
whether
the
it's
women are always the ones that are
right.
to blame.
Well, that's how it was historically.
Yeah.
That's how
Yeah.
it was historically, in all fairness. But then over time, we figure out it's 50-50,
Yeah.
both male and female. So if the female is going through the evaluation process, the male also comes to the
Should go through that.
urologist.
Right.
And that's where we do a semen analysis and we start looking into things. We get ultrasounds of the genital area, the scrotum, to make sure there's nothing there. And yeah,
Hmm.
but that's where sometimes we're involved on that side of things when it comes to infertility.
Awesome.
Yeah.
Awesome. Wow. That's another topic.
Beautiful
It's
thing.
another
Yeah.
topic. All right. Well, thank you. Thank
My
you. Thank
Yes.
pleasure
you
We
again.
again
Thank you.
appreciate you.
for coming. I'm
Yes.
looking forward to, like I said, Thursday. We'll say it again. Thursday is called Man Up for Your Health. It's for the family at the North End Recreation Center from 6 p.m. to 8
Yeah.
p.m. You can go onto our website. We'll put the flyer up. You can register ahead of time, but you don't have to. You can come walk in, bring your family, bring the young men if you're especially if you're a mentor. We have a lot of
Right.
men around here that are mentors with
Right.
young men. Bring them with you. This is an event that is going to be very enlightening and something that they could utilize in their life as they become adults.
Yes.
So this way they're not going into adulthood, blind.
Without guidance.
Yeah,
Not
Yeah.
without
knowing. Yeah.
guidance. Yeah, yeah. So thank you, thank you, thank you. And guess what? If you don't take care of your body, where you gonna live?
That's
All
it.
right, all right.
All right.
Thank you.
Thank
Thank
you.
Um,
you. Thank
talk
you.
to you
All right.
soon. Have a good one.